Hi, my name is Mohammad Ali Haider, and today I will be delivering pharmacology lecture number 6, duration of action. Finally, because enzymes are usually stereoselective, one drug dynamometer is often more susceptible than the other to drug metabolizing enzymes. As a result, the duration of action of one enantiomer may be quite different from that of the other. Similarly, drug transporters may be stereoselective. Unfortunately, most studies of clinical efficacy and drug elimination in humans have been carried out with racemic mixture of drugs rather than with the separate enantiomers. At present, only a small percentage of the chiral drugs used clinically are marketed as the active isomers. The rest are available only as racemic mixtures. As a result, many patients are receiving drug doses of which 50% less active, inactive, or actively toxic. Some drugs are currently available in both the racemic and the more active isomer forms. Rational drug design. Unfortunately, the hope that administration of the pure active dynamers would decrease adverse effects relative to those produced by racemic formulation has not firmly established. However, there is increasing interest at both the scientific and the regulatory levels in making more chiral drugs available as their active dynamers. Rational design of drug implies the ability to predict the appropriate molecular structure of drugs on the basis of the information about its biological receptor. Until recently, no receptor was known in sufficient detail to permit such drug design. Instead, drugs were developed through random testing of chemicals or modification of drugs already known to have some effect. Computer programs. However, the characterization of many receptors during the past 3 decades has changed this picture. A few drugs now in use were developed through molecular design based on knowledge of the three-dimensional structure of the receptor site. Computer programs are now available that can iteratively optimize drug structures to fit known receptors. As more common becomes known about receptor structures, rational drug designs will become more common. Receptors nomenclature: the spectacular success of new, more efficient ways to identify and categorize receptors has resulted in a variety of offerings and sometimes confusing systems for naming them. This in turn has led to the number of suggestions regarding more rational methods of naming receptors. Thank you very much. Inshallah, we will meet again. Take care. Allah Hafiz.